So today I'm going to show you how to remove a nasal cavity foreign body by using endoscope. So as you can see, I'm using a 0 degree endoscope on a Karl Storz system. As you can see, the patient is completely under general anesthesia. Now this patient is a male kid, 3-year-old kid, brought to my emergency department by his parents with a history of multiple round, smooth surfaced pearls inserted, self-inflicted insertion of foreign bodies. So four of them came out easily, but this one, the fifth one, got stuck somehow. So I tried to remove the foreign body by using the conventional method, the patient being fully conscious oriented, but somehow the patient was sustaining a lot of injuries. So we chose to finally go under general anesthesia. As you can see, I'm trying to decongest the area, and so that gives me a proper field for my endoscope, because I need to completely rule out the chance of leaving behind any foreign body whatsoever. So we gotta have a complete picture of the nasopharynx, both nasal cavities. As you can see, the patient is having severe inferior turbinate hypertrophy, so I'm going to decongest. So there are certain guidelines. Now, as this patient is a really young patient, we need to remove the foreign body. So as you can see, that's the foreign body you can see at the nasal floor, which is kind of stuck between the inferior turbinate and the nasal septum. So this foreign body is spherical, smooth surface. If the patient is given drops, decongestion drops, the inferior turbinate will collapse and the patient's foreign body will drop into the posterior nasopharynx. And if the patient is crying or shouting a lot, the foreign body may get lodged into his larynx, which is called as aspiration. So as you can see, I'm using a JH probe, Jobson Horns probe, to just carefully remove that foreign body. As you can see, the size of the foreign body is kind of big, so make sure you carefully remove that without traumatizing the mucosa. As you can see, very gently I'm trying to keep it outside the nasal cavity so it doesn't fall back. And there you have it, remove the nasal cavity foreign body. So the second step is to, after having removed the foreign body, make sure you check the entire nasal cavity, decongest it for presence of any second or third foreign body as well. So there's no as such need to do a x-ray before the surgery, because x-ray is going to unnecessarily expose the patient for radiation. Only in case of doubt, where the history is not complete or the parents do not know about the presence of any other foreign body, you may go for a x-ray. So as you can see, I'm trying to decongest the area. Once I do that, so I'll be able to check the area much more clearly. So as you can see, the picture is much more clear right now after a lot of washing and decongestion. And the most common second site for foreign body lodgement is the area of the nasopharynx. As you can see, this patient has got huge adenoids, and the patient may have a chance of the foreign body being lodged within the cleavage of the nasal floor and the adenoids. So we gotta be more careful. We gotta check each and every corner. So after having checked the choana, I'm going to check the middle meatal area. So I'm going to push the patient's middle turbinate to the medial aspect, so I can see the middle meatus. As you can see, this is the bulla ethmoralis, and this area is also clear of any foreign body. So one more area to be covered is the inferior meatus. So as you can see, I'm going to try to elevate the patient's inferior turbinate, because there is a lot of chance that the patient's inferior turbinate, inferior meatus also may lodge a foreign body. So as you can see, the area is free of the foreign body. Also remember to check the patient's opposite side nasopharynx. As you can see, this is the patient's adenoid tissue, severely hypertrophied adenoids. So there are a lot of cleavages, a lot of spaces I can see between the patient's adenoid tissue. So the patient may also have a foreign body lodged within them. So after having checked all the areas, check for the opposite side and make sure that the patient does not have any foreign body. The final step is to have a proper hemostasis to achieve a good control on the bleeding whatsoever. If there is a mucosal laceration or a mucosal trauma, make sure you use a neuropathy and compress the area till the bleeding stops. If the bleeding does not stop or is having a little bit of ooze, then you can of course use small flat rectangular or square pieces of Abgel. So as you can see, I'm trying to place a piece of Abgel, and then with the help of Jobson Horn's probe, you can use an ear instrument because of the pediatric nasal cavity is small. As you can see, there was a small mucosal area of trauma at the lower surface of the middle turbinate. So I'm going to keep three pieces. I'm going to keep three pieces of my Abgel in the patient's undersurface of the middle turbinate. So very gently you have to keep it. Make sure it doesn't fall loose in the nasal cavity for that the patient should not aspirate that small piece of Abgel as well. So as you can see, I'm carefully putting the piece of Abgel on the area of contact, and over a period of time it will keep on soaking the blood and keep a constant pressure as well at the same time, so making a good control on hemostasis. The final step after having checked the entire nasal cavity, the final step is to check for the oral cavity, the oropharynx. If at all the patient, as you can see, is in supine position, there's a good chance that the foreign body, if smooth, spherical, may slide and may get pushed to the very posterior aspect of nasal cavity and fall off into the oropharynx as well. So as you can see over here, my anesthetist is assisting me in opening the oral cavity. So as you can see, that is the array epiglottic fold, and that's the intubation tube. And I'm trying to just do a suction to have a clear picture of all the entire anatomy. So you can see the intubation tube going in the vocal cords right there. So the entire area is free of any foreign body as such. So this makes my surgery for foreign body removal from the nose complete. So after having done all these steps, only then you can make sure that the patient doesn't have any foreign body left. Just to be sure, you can have a post-op chest x-ray. Along with that, you can have a x-ray paranasal sinuses to make sure that the patient doesn't have any remnant or residual foreign body as well.